Hello, everyone. I'm Rebecca Nelson from Monument Builders of North America, and welcome to today's webinar. Over the next hour, we will learn about the MBHealthcare Program. As a reminder, this webinar is being recorded and attendees will be muted for better sound quality. You may type questions at any time using the Q&A feature, and we encourage you to do so as questions arise rather than waiting to the end. To access that, hover your mouse over the bottom of the Zoom window and a menu bar will appear. Q&A is an option and you can click on it. Additional information regarding the program can be found on our website, monumentbuilders.org. We are joined today by Kevin Kennedy with Small Association Leadership Alliance and Derek Parsons with Interwest Insurance Services. Kevin Kennedy is CEO and a founding committee member of Small Association Leadership Alliance. He has more than 20 years of diverse experience, having worked for more than 24 associations, professional societies, and nonprofits. Derek Parsons is an employee benefits broker at Interwest Insurance Services. He earned his registered health underwriter designation with a focus on group benefits plans, self-funding, benefits compliance, and health maintenance organizations. I will now turn the floor over to Kevin and Derek.
Great, thank you very much, and welcome everyone to the presentation today. Again, we're talking about the healthcare program. I'll give you some quick background on the program. In bringing the program together over the course of the last 3 years, we really had two items we were trying to address. One was to have a national program, and two was to reduce costs in a meaningful way. In other words, we didn't want to go through all this effort and also have MBNA go through all this effort. If we were only going to save people a little bit of money, we wanted to have a much larger impact. The program itself is really an effort to simplify just the ever-increasing complex nature of our healthcare. The program offers a great choice of options. It helps members meet ACA regulations on preventative care. And you'll see that last bullet there, it offers savings right around 60%. Now that's an average compared to what folks would pay for insurance on the state exchanges, and it varies pretty dramatically by where you live, not even just by what state you live in, but by where you live within that state. Where I live, for example, right outside DC, my savings is right around 55%. Folks in more rural areas are saving 75, 80% or more. We'll get on into all the details with all the pricing towards the end of the program and review all of that. One last bullet here. Over the summer, we conducted a survey of all participants in the program, and 91% reported being either very or extremely satisfied. I think perhaps the best quote we've received from that survey was an individual who said it's the same healthcare he has always had, just at half the price. But what we're talking about here is really an alternative approach to traditional health insurance. The programs we're discussing today are not health insurance, and we have two main partners in bringing the program together. The first is Apex Management Group. The Apex Group offers two plans for folks to choose from, the Advantage Plan and the Basic Plan, and the focus on those plans is really preventative care. The Advantage Plan offers prescription drug benefits and some other options, and I'll go through both of these plans towards the end. Folks then pair that plan with a plan from Sedera Health. Sedera is medical cost sharing. I'll spend most of my time today talking about Sedera and talking about medical cost sharing to make sure folks have a real good understanding of how that works. But really it's through Apex and Sedera, along with a couple of other partners such as Teladoc and WellDyneRx, that we get to a comprehensive, cost-effective alternative to traditional health insurance. The program itself, and really our healthcare, has three main components. There are large costs, and these are the more significant unforeseen medical events we all go through at different points in our lives, such as hospitalization or maybe just diagnostic imaging, but the serious expensive items, if you will. There are small to medium costs, which is more the run-of-the-mill type stuff, cold, a sinus infection, flu, kind of the nuisances that we all have throughout the year. And then there's preventative care. And preventative care is, of course, everything from childhood immunizations to your annual physical, to your colonoscopies, mammograms, and all other scheduled preventative care that we have. The program itself addresses all three of these, and I'll talk about each one in detail, starting, of course, with the large costs. The large costs we refer to as needs, and again, this is the unforeseen, unexpected costs, the significant items. It could be everything from running your kid down to the ER for stitches to a cancer diagnosis and really everything in between. These needs are addressed through the Sedera membership. Now, Sedera is medical cost sharing. If you're not familiar with medical cost sharing, it's really had a foothold in religious groups going back to the 1980s. Different churches or congregations would form an organization through which their members can participate and share in each other's expenses. Sedera itself is not a religious organization. They don't have any religious affiliation. In fact, their parent group is actually called the CARES Group, and the CARES Group is a medical bill negotiating company, and they're the company that many of the religious organizations have used to negotiate their larger bills since the 1980s. Well, when all of our medical costs really started to increase in just an unsustainable rate, the CARES Group formed Sedera. Again, Sedera does not have any religious affiliation, but their objectives are really all of our objectives. It's compliance and credibility, it's lowering our monthly expenses, and reducing our out-of-pocket costs. So when I go through the cost of the program, you'll see that it will certainly save everyone money on the front end with the lower monthly contribution, but also on the back end with the lower out-of-pocket costs. And I'll go through all those details in just a few minutes. A few comments on medical cost sharing. Obviously, big savings over health insurance. As I said, it's healthcare through community as opposed to healthcare through insurance. As of the end of 2017, there were more than 1 million members sharing more than $1 billion annually, and that number is actually close to 1.4 million now. Sedera offers freedom from networks, and that's perhaps the most attractive thing that people talk about most often. If you have to use your Sedera membership, you can go to any hospital you like, any doctor you like to get the care that you need. You do not have to operate within any network. On the Apex side, for your preventative care, there is a network that we use, and I'll talk about that in detail. But again, on the Sedera side, it's freedom from networks. Get the care. You can go to any hospital or doctor you like to get the care that you need. Now, sharing begins at what is called your IUA. That's your initial insurable amount on a per-need basis. That's what your financial responsibility is if and when you do become ill and need to use your Sedera membership. There are 5 levels to choose from, and I'll go through those in just about 2 slides. But it's important to note that that is on a per-need basis as opposed to a deductible that's on a calendar year basis. So it offers another way to save some money. Here's a real quick illustration that shows the adoption rate of medical cost sharing. You'll see the uptick starts here right around 2011, 2012 as folks started looking for an alternative as all of our healthcare costs started to increase. And that alternative here is really what we're talking about today. So let's talk about it. Let's talk about how Sedera works, and let's talk about a need. So what is a need? Excuse me. A need is one or more medical expense caused by a single accident or illness. So if we look at this illustration on the left, this is an individual who broke their leg. So there's a cost for the ride in the ambulance, surgery, the stay at the hospital, diagnostic imaging, prescriptions and pain medicine and physical therapy, and all of these costs are wrapped up into that one need. Now the member's responsibility is that IUA, the initial insurable amount. And as I said, our program has 5 levels for you to choose from. There's $500, $1,000, $1,500, $2,500, or $5,000, and that's what your responsibility is if and when you have a need. So let's say the total cost for the broken leg and surgery was $10,000, and you had selected the Sedera membership with the $1,000 IUA. You would be responsible for paying that first $1,000. The balance, the $9,000, would be shared through Sedera and paid accordingly. Now, if you enroll as an individual, you're responsible for the first 3 needs in the calendar year. If you enroll as a family, you're responsible for the first 5. As a practical matter, we all hopefully have fewer than that in the calendar year. But if you did have a 4th as an individual or a 6th as a family, you would have a $0 IUA. In other words, there would be no out-of-pocket cost for you on any needs above and beyond the first 3 or first 5 as a family. So as you look at this and you look to calculate what your potential exposure is financially, what your max out-of-pocket would be, if you enrolled as an individual and selected the $1,000 IUA, and you had 3 such needs in the calendar year, your maximum exposure would be $3,000. So for many of us, it's certainly less expensive than the deductibles we have had historically, and works really quite well. Here's a real quick real-life example. This is actually from the CEO of Sedera. Prior to joining Sedera, he and his family had a young child with a persistent ear infection. They, of course, had traditional insurance with a $5,000 deductible. The child, after a series of booster injections, went to an ENT who inserted tubes into the child's ears. On the left, you can see the out-of-pocket cost for traditional insurance with co-pays and then the cost of the surgery. It's right around $2,500. On the right, if they had selected the $500 IUA, of course, their cost would just be $500. So really, the way the reimbursement, or pardon me, the sharing works is in 2 ways. One is with the broken leg scenario. Obviously, you broke your leg, you go to the hospital, you immediately get the care that you need. You would then be asked by the hospital, how are you going to pay for this? you would tell them that you're a self-pay patient or a cash pay patient and ask them to bill you. At that point in time, you could then pay that IUA that you had chosen, say the $500 IUA, but you take those bills and you upload them to Sedera through their app, much like filing a claim, if you will. Sedera then issues checks every Wednesday, and generally you'd be paid in about 15 to 30 days. So if you had the child with the tubes put into their ears, you would be responsible for $500. Sedera would then send you a check for $2,025, and you would pay the balance of your bills. The second way this works is, let's say you had a scheduled surgery. Say you tore your rotator cuff. You would call Sedera and say, I tore my rotator cuff and I'm having surgery in 2 weeks, or whatever it is. Sedera would then reach out to the doctor, reach out to the hospital, and they would look to prepay for that surgery. And the reason is that's how they save the most significant amount of money. They save on average between 47 and 53% by prepaying for surgeries. It was actually pretty eye-opening for all of us when we spoke to a few hospitals a couple of years ago as we began to learn more about this. And hospitals openly said that if someone prepays for their surgery, they automatically discount it 50%. So that's the two main ways in which the Sedera sharing works. I should note that you do not get a card for your Sedera membership, much like you have a card for your insurance company. There is no card. Again, you just say that you're a self-pay patient or a cash pay patient. On the Apex side, you do get a card, and I'll talk about how Apex works in just a few minutes. I'm going to continue on here with Sedera.
So, Kevin,
yeah.
Quick question. One of the biggest questions, most common questions I get from employees is, how much does it cost for having a child? And I I always estimate about a normal vaginal delivery is about $15,000 cost-wise. So if you're on the $500 IUA plan with Sedera, how much would it cost for a $15,000 normal birth?
Okay, so birth is child delivery is outside of the normal IUA, so it's a flat $5,000. Okay. Okay, so let me talk about some nuances of the plan. That's membership, medications, and pre-existing conditions. Let me start first with medications. There are basically two types of medicines we all take, those that are curative and those that are maintenance. The curative medicines are medicines we take until we're cured. We take them for a period of time. There's an end date at which point we stop taking those medicines. These could be antibiotics or pain medicines or chemotherapy drugs, but the costs for these curative medicines are wrapped up into that need, wrapped up into that IUA math that we just discussed. The other type of medicines many of us take are maintenance type medicines. These could be medicines for high blood pressure or high cholesterol. An overactive thyroid seems to be a pretty common one. I take it for rheumatoid arthritis. These are medicines we take daily or weekly or often, however often they are prescribed, and we'll take them for the foreseeable future. The Apex plan, which I'll talk about in just a few minutes, but the Apex Advantage plan specifically has a great prescription drug program. That's how I get my medicine filled. Folks may also want to look to Liberty Benefits as an add-on, or CleverRx. CleverRx is a great program that Derek could talk about here in just a minute, but it's some that some of your colleagues and board members use on a regular basis. Derek, did you want to talk about CleverRx?
Sure. It's just a cash pay prescription card that everyone would get, and they don't even, let's say that an employee is enrolled in Sedera, they could use the cash pay prescription card for their entire family, even if they weren't enrolled in Sedera. And it's just another option to shop for prescriptions. So let's say that you had the Sedera plan with the just the basic non-buy-up prescription coverage. You would use CleverRx for a cash pay discount on prescriptions. But if you had the Sedera plan with the buy-up advantage for prescription costs, then you'd have two places to price prescriptions. So you'd go to your pharmacy and say, hey, I need to fill this prescription. Can you price it with Advantage? And then you would say, now can you price it with CleverRx? And you just go with the less expensive method to get the prescription. It's just giving everyone an option. It's better than just having one option. And we find that sometimes Advantage is cheaper and sometimes CleverRx is cheaper. And so you get a chance to, the other nice thing with CleverRx, which is a good tool, is that it has online, you can shop prescriptions and it'll show you all the pharmacies within the geographic area and their prescription prices. You'll see that Costco's, Sam Clubs, Walmart's, are typically some of the cheaper pharmacies get prescriptions filled, but a lot of times, you may not go to Sam's Club or a Walmart and not realize that you could save $30 or $40 on your prescription. So that's a good tool and resource through CleverRx.
Absolutely. And just to be clear, the prescription drug program is actually on the Apex side of the program. Sedera does not have any prescription drug coverage, but I'll clarify that as we go through the program a bit more, and we can talk more about CleverRx then as well. Now, when members do sign up, they do have to commit to a few things. One is to strive to live a healthy and balanced lifestyle. That's obviously not legally binding. They're not going to make sure you're exercising every day and eating well. But making smart choices like diet and exercise can greatly improve one's quality of life, but it also keeps us all out of the doctor's office and out of the hospital and keeps all of our costs low. Members do have to commit not to use illegal narcotics and not to operate a vehicle while intoxicated. So what does that mean? That means if you're driving a vehicle while intoxicated, you get into an accident and you have medical bills, those bills cannot be shared with Sedera. The principle here is that the community should not have to pay for someone's illegal activity. Also, tobacco users are certainly welcome to join. Everyone is. There's a $75 surcharge per month per household. So if you have a husband and wife who both smoke and are enrolled in the program, it's only one $75 surcharge, not two. Also, the fine print here, tobacco users over the age of 50 have a $25,000 per need sharing limit for the top 4 diseases associated with tobacco usage, which is heart disease, stroke, COPD, and cancer. I think this next slide is perhaps the most important in the program. This is where we get the majority of our questions. And this is where we spend the most time in talking with folks to make sure they have a real clear understanding of what they're signing up for, and that is pre-existing conditions. Now, a pre-existing condition is defined on anything you've had a symptom of or received treatment for in the prior 3 years to signing up. Now, if you have any of the top 4 listed here, high blood pressure, high cholesterol, sleep apnea, or non-insulin dependent diabetes, assuming they're well controlled with medicine, of course, there are no sham restrictions. You have to disclose them, of course, as a condition, but there are no implications to your membership at all. If you have anything else, and I'll use myself as an example here with my rheumatoid arthritis, there are sham restrictions. So when I enrolled, I did disclose I had rheumatoid arthritis. And what the restrictions are, well, let me explain it to you this way. Through the Advantage plan, the Apex plan, visits to my rheumatologist are covered. It's a $50 copay. I use that for my prescription drug program. It's managed through WellDyneRx, and it's a very low cost for my prescription drugs, but they're all covered. What this is saying is if I were to have a need, if I were to have a medical event as a result of my rheumatoid arthritis, that's when these restrictions would come into play. Let's say, hypothetically, I needed surgery. If I had needed that surgery in my first year, I could not share any of the costs for that surgery. In year 2, I could share up to $15,000. Year 3, up to $30,000. After that, it's fully shareable. What we generally tell folks is that the program itself is a great option for folks to consider, but it's not the answer for everyone. It's probably a good option for about 80–85% of folks to consider, including many of us with pre-existing conditions. But say, for example, I had an active cancer, or say my wife was currently pregnant, now would not be the time for us to join because it would create an obvious financial burden for us in that first year, and second year, and perhaps third year. So we spend a lot of time talking with people. Generally speaking, most people know the status of their conditions. But if people have questions at the end of the program here, you'll see all of our contact information. Please don't hesitate to reach out to us. We can explain to you exactly what the restrictions are and how they work and get further clarity for you on your condition. The last thing we want is for anyone to sign up and enroll in the program and not fully understand exactly how these pre-existing condition restrictions work. So please just reach out and let us know if you have specific questions, and we will answer them all for you. But that's it for the large cost component. Again, of the 3 components that are involved in our healthcare, the large costs involve the significant items, the unforeseen items. Now I'm going to talk about the small to medium costs. These are the smaller, less serious items: the cold, sinus infection, perhaps the flu. Included with everyone's membership is a subscription to Teladoc. If you're not familiar with Teladoc or with telemedicine, Teladoc is actually the largest provider of telemedicine. Telemedicine itself has really caught on in recent years. More than 75% of Fortune 500 companies now offer telemedicine, and the reason is it's a money saver and a time saver. To use your Teladoc subscription, there's no additional cost to you. There's no out-of-pocket costs. It's fully included. And telemedicine is exactly how it sounds, if you will. You connect with the doctor virtually over the phone or through your computer. And the reason most companies now offer telemedicine is because it is a money saver and a time saver. As I said, there's no out-of-pocket cost for you in terms of time saving. Instead of going down to your local urgent care or going to see your primary care physician, you connect with the doctor virtually over the phone or through your computer. So if you just need, say, a Z-Pack for a cold or a flu, or we had a woman recently who used it for an eye infection. She did a video call with the doctor. He diagnosed what it was, sent a prescription to a local pharmacy. She picked it up and it was cleared up a few days later. So it's really an outstanding service. We had actually spoken to Teladoc a few years ago just about seeing if we could bring it on as a standalone option, but it's really just a truly great service. Also included is Second MD. Second MD is a great way to get a second opinion on anything you're going through medically, of course, and it's from some of the nation's top doctors that practice at places like the Mayo Clinic and Johns Hopkins. Second MD is here for two reasons. The first reason is that there was a study that showed that the average physician was 13 years behind on his or her continuing education. So Second MD ensures that we all have the most up-to-date information available to us to make any decisions on our health that we may have. Also, if you're having an elective surgery, Sedera requires you to get a second opinion, and you'll do that through Second MD. I should note that that second opinion is not binding in any way. You and your doctor make the decision on what's best for you and your health, but it just makes sure that we all have the most up-to-date information. Okay.
Kevin, can I speak to the Teladoc real quick?
Sure.
Yeah, so the Teladoc is a huge benefit. The way I've seen it used in the past is we actually have it personally, for our family. I got a 4-year-old and a 6-year-old, and they have 24 hours a day, 7 days a week access to talk to a doctor. These are all board certified physicians. They can call in prescriptions to your local pharmacy, and I remember that I think one of our kids had an ear infection, and so we used telemedicine, and we called in, and I remember I timed it, and I said, how long is it going to take me from talking to a doctor to actually getting the prescription filled? And we called Teladoc. I think we got a call back usually within 10 minutes. You can do it any time of the day. And by the time I talked to the doctor and got the prescription at our local pharmacy, it was 45 minutes. So that's unheard of. So that was a huge benefit to us. We use it all the time. We just see that it's really, really effective, and employees, tend to love it. It's going to reduce your PTO days at work. You can call at 2 a.m. in the morning. So it's a great service.
Absolutely. Thanks for that, Derek. Okay, so now I'm going to move on to the third component, which is preventative care. And I'm also going to switch gears now and talk about the Apex side of the program. If you recall, when you first enroll, you actually first pick the Apex plan that best fits you and your family. And there are two options to choose from. You would then pair that with the Sedera membership that best fits you and your family. So when you enroll, you're actually enrolling in two separate programs, and they don't talk to each other, but the Apex covers your preventative care and your smaller costs. The Sedera covers your larger unforeseen costs and also your small to medium costs. So let me talk about the Apex plans now, and there are two to choose from. This first option is the basic MEC plan. Probably 20, maybe 25% of the folks who sign up choose this option. This option, as you can see on the top half there, offers 100% coverage for all your preventative care needs. These are the needs that the Affordable Care Act define. That's 21 for adults, 28 for women, 31 for children. If you recall, in 2018, the IRS and prior, the IRS would issue penalties to folks who did not have the mandated preventative care coverage. This program, as well as the second option, meets all those requirements. So even though the IRS penalties have gone away, some states have implemented those penalties and others aren't considering it. So if you live in a state like New Jersey, for example, that has those penalties in place, this program meets those requirements, so you would not have any penalty. This basic MEC plan only covers your preventative care. It does not offer any prescription drug coverage or any sort of other ongoing care. It is simply for preventative care. And like I said, only about 25% of folks who sign up enroll in this option, and they are folks who are in good health, not on any prescriptions, don't go to the doctor on a regular basis, except for perhaps their preventative care. So this is a great way for them to get all of their preventative care covered, pair it with a Sedera plan, and it also allows them to set up a health savings account. An HSA, as you probably know, is a great way to put away tax-free dollars to be used down the road towards any future qualified medical expense, dental, doctor visits, prescriptions, and it can also be used to pay your Sedera IUA. So for folks, like I said, who are in great health, this is a great way to put away some tax-free dollars to be used down the road for when they need them. The second option is the Advantage plan. This is actually the plan I am on. Again, it offers 100% coverage for all your preventative care needs. It then has a more familiar co-payment structure. So if I go to my primary care physician outside of preventative care, it's a $20 copay. If I go to a specialist, such as my rheumatologist, it's a $50 copay. And labs and imaging is also a $50 copay. This program also has the prescription drug program. And this is how I get my medicine filled for my rheumatoid arthritis, for example. And when I talked about the prescription drug programs a few slides ago, the curative versus the maintenance drugs, generally speaking, your maintenance drugs are in the tiers 1, 2, and 3. Tiers 1 and 2 are generic. Tiers 3 preferred brand name. Tiers 4, 5, and 6 are generally drugs that are more curative in nature. As Derek also said, CleverRx also offers great discounts. So it's a great way to, you can go online here and check out what the cost would be through WellDyneRx for your prescription drugs on this program, and then also compare and contrast that to what CleverRx would charge and get the best price for you and your family. As a basis for comparison, the medicine I take for my RA is $13 on mail order and $27 or $28 if I go and pick up at the CVS. So it's actually just a little bit cheaper than what I've always paid historically, and a great program all around. Now, when I talked about Sedera, I made note that Sedera did not use a network. They offered freedom from networks. You can get any doctor you like, any hospital you like. On the Apex side, for your preventative care or for any ongoing care, they use the multi-plan network. The multi-plan network is one of the largest networks in the U.S. There are more than 900,000 participating providers in the network. So when I joined up, I checked, and my primary care physician was in there. My rheumatologist was in network and really has great coverage. If you have a question about doctors who are in the network, I would actually encourage you to just send us an email. You have our emails at the end of the presentation here, and we can run a complete list of doctors and facilities by zip code, and it's the best way to get a list of what doctors are in network. So let's talk money and let's talk price and what all of this costs. This first slide here is obviously for the Apex plan. I should note that we all pay the same, regardless of our sex, regardless of where we live. We're all going to pay the same amounts on this program. On the left here, you'll see is member only. That's if you sign up as an individual, or you and your spouse, or you and just the kids, or you and the entire family, meaning spouse and children. The second column here is a basic MEC plan. Again, that only offers coverage for your preventative care needs, but does allow you to set up an HSA. You'll see the price starts at $71 per month and goes to $102. This third column is the Advantage plan. Again, it covers 100% of your preventative needs. Then offers a more familiar co-payment structure for any ongoing care, and of course, prescription drug coverage. You'll see this red arrow here. That's actually the plan I am on for $144.59 per month. You would then pair that with the Sedera IUA that best fits you and your family. As you recall, there are 5 levels to choose from: 500, 1,000, 1,500, 2,500, and 5,000. For space reasons, we only have 2 listed here, although I'm going to bring them over in just a minute. MO is member only. MS is you and your spouse. MC is you and just the kids. And MF is you and your entire family, spouse and children. It's then banded by age for those in their 20s, 30s, 40s, 50s, and 60s. You'll see the red arrow. That's actually the IUA I am on for the $1,500 IUA for $175.51. You'll note that the higher the IUA, meaning the more you're willing to pay out of pocket, the lower your monthly contribution is. If I had chosen the $1,000 IUA, my cost would be about $15 more per month. And just for comparisons, here's the full list of IUAs. If I had chosen the $500 IUA, my cost would be $212. The $1,000 would be $191. And you'll see it goes down from there until we hit $5,000, which would just be $134 per month. So here's a summary, just for example, but this is the program I'm on. And this will be the same for everyone in their 40s who picked the Advantage plan and the $1,500 IUA. Again, I have the Advantage plan, which offers me prescription drug coverage and the co-payment scenario for ongoing care when I see my rheumatologist. I then have the $1,500 IUA. So if I were to break my leg and need surgery, that would cost me $1,500. If 2 months later I broke my arm or whatever it might be and need surgery there, that would cost me another $1,500. And because I'm on an individual plan, my maximum exposure there is 3 needs in the calendar year. So my max out of pocket, if you will, would be $4,500 if I had 3 such medical events in the calendar year, which would obviously be a bad year, but financially it would still be significantly less than the $7,000 deductible I would have to meet on my old plan. So my monthly cost is $320 per month. That was about 55% less than what I would pay on the Blue Cross Blue Shield plan I had out here. And again, this varies, the savings rather varies dramatically by where you live, not just by state, but by where you live within that state. But again, we all pay the same through this program here.
Hey, Kevin, can we go back a slide? So I think it's, can you go to the $500 deductible? I think it's important that we illustrate how that's going to work for a year. So if you're on the $500 IUA and you have a knee surgery, that's $5,000, and it's not a pre-existing condition, that would be $500, correct?
Correct.
So let's say you go into the ER and you can't breathe and it's $3,000 a bill. That's $500 for that in the same year. That's $500 for that, right?
Mm-hmm.
Okay, so you have a third event. Let's say, hey, I need to get my shoulder replaced. That's $500 for that event, right?
Right.
So if I have a fourth event, then I would not pay the $500 again.
Right. Like I said, if you sign up or enroll as an individual, you're responsible for the first 3. If they were to enroll as a family, it would be 5.
So my worst case scenario for the year, if I was on the $500 IUA, you could say that it would be $1,500.
Exactly. Right.
Perfect. Thank you.
All right. So on the MBNA website, there's a wealth of information. There's also a recording similar to this. I know they're recording this one as well, but you'll find all the details, including the current rate sheets, details on Sedera and the Apex plans, telemedicine, and 2nd.MD, as well as this multi-plan provider search. Although, again, like I said, I would encourage you, if you need a complete list of providers in your zip code and surrounding area, just send us an email. A quick summary of the offering. It's available in 48 states. It's not currently available in Vermont and Alaska. It does not need an employer sponsor, so individual employees can join. They can be full-time, part-time, or seasonal workers, hourly or salaried staff. The monthly cost can be paid by the employee or the employer. So if you're an employer and you have a staff and you'd like to extend the healthcare program to them, you can certainly do so and pay the bill and then offset that bill with a payroll deduction or whatever you choose to do. If you're an employer or maybe just an individual, and you're not able to offer the program to your staff, or you're an individual looking for healthcare, you can certainly just enroll as an individual and pay that on your own as well. The one caveat here, of course, is in order to enroll in the program, you must, of course, be a member of MBNA and be a member in good standing. Of course, you'll see, as we mentioned at the beginning, the average savings is right around 60% compared to what folks pay for on the exchanges. And again, that varies quite a bit. But like I said, my savings is right around 55%, and I'm in a pretty well-populated area. Lastly, coming hopefully here in November, will be a dental plan that uses the Aetna network. I say hopefully here, but all the agreements are in place. They're just working on the technical issues behind the scenes to make sure everyone can enroll in the dental program through the same enrollment process that we have for the other programs. Speaking of the enrollment process really it's a shopping cart experience. You enroll, you pick the Apex plan that best fits you and your family. Then you pick the Sedera IUA that best fits you and your family. And then you can add on a dental option and then eventually vision as well through VSP. But the enrollment process itself, really, depending on how many dependents you have, really only takes about 10 minutes to enter all your information and enter your dependent information as well. Again, when you enroll, you're signing up for 2 plans. One is on Apex. Apex has 2 plans to choose from, the basic plan and the advantage plan. And you do receive an insurance card for those plans, and that's what you would present if you go to the doctor. You then have a Sedera membership, And Sedera, again, you have 5 IUAs to choose from, the 500, 1,000, 1,500, 2,500, and 5,000. And that's what your financial responsibility would be. So lastly here, let me just throw up our contact information. If you have any questions on the program itself, I would encourage you to use this top email, hbsupport@smallassociations.org. That gets you into our queue, and that's probably the fastest way to get a call back from our folks. You can also, of course, call the 800 number, 888-994-4979, or general information boxes here. If you have questions about the program or questions on any pre-existing conditions, or if you'd like to see a list of all providers in your area for the preventative care on the Apex side of the program, please let us know. Also, Derek's email is here as well. Derek is, of course, with InterWest. So if you have questions on more traditional insurance or the CleverRx program, please reach out to Derek as well at dparsons@iwins.com. But I'm going to throw this slide back on. Actually, I'll leave this slide up. I'll tell you a couple other key dates to keep in mind. If you're looking to enroll for January 1st, just for you individually, or perhaps you and your staff, you would need to enroll by December 18th. The 18th is the cutoff date for every month. We actually have rolling enrollment. You can enroll at any time during the year and leave at any time during the year, but the 18th is the cutoff. So for folks who enroll by November 18th, for example, their coverage starts December 1st. Folks who enroll between November 19th and December 18th, their coverage would start January 1st. If you are an employer and you would like to offer this to your staff, we would need you to reach out to us. We would send you a form. It's just a one-page form. Has your billing information, other demographic information on there. We would then set you up with your own dedicated enrollment site for you and your staff to use to enroll in the program. You would, of course, receive a bill each month detailing who is enrolled and on what program. If you're an individual and you're looking to enroll, you can actually do that through the MBNA website. Just follow the prompts that are listed on that page. But with that, there actually haven't been too many questions today. Derek did ask a question about the pregnancy. Just to reiterate, pregnancy is the one difference where the IUA does not come into play. A pregnancy for normal delivery would be $5,000. A C-section would be $7,500. Everything else follows your IUA that you choose. So if you had a heart attack or a cancer diagnosis or a broken leg or whatever it might be, your financial responsibility is that IUA that you choose. On the Apex side, again, the basic plan does not offer prescription drug coverage and does not offer any continuing care. It only offers preventative care coverage, but it's a great option for folks who are in great health. The Advantage Plan offers prescription drug coverage and offers the copayment structure for ongoing care. It costs a bit more, but for some of us, like myself, who need that, it's still significantly less than what we have paid historically. And of course, like Derek mentioned, the CleverRx program is a great program. Great to have some comparison numbers as well if you're looking for your prescriptions. Lastly, I would mention that if you have a larger group, or even if you don't have a larger group, there are no minimums and certainly no maximums in terms of joining and offering this program. You can have just one person enrolled or multiple people enrolled, but you can also offer traditional insurance alongside of it. And if you'd like to discuss that more, I would certainly reach out to Derek and his team at InterWest. But with that, Derek.
Yeah, that's the important part to mention is that you can pair this with a traditional insurance program. In most cases, you just have to be considerate of any participation requirements that the carriers, advise you to follow. But, we have many people that have paired Sedera with the traditional insurance program, and it works very well.
Susan, I see you have a question. If you could put that question into the chat window or into the Q&A, I saw you raise your hand. That would be the easiest way for us to answer that. Or feel free to send us an email at hbsupport@smallassociations.org, and we will get an answer to your question. Were there any other questions out there? Oh, here we go. Can we get a financial statement of Sedera? What are reserves of the plan? What happens if the plan is low on reserves? Anonymous, they do not disclose their financials. They are a privately held corporation, and that is not something they disclose. I will tell you a couple of facts. Sedera has never had a claim they did not pay. They never had a claim that they short paid. Everything has always been paid in full. Also, they've never had a rate increase since 2012, just one rate decrease. Speaking of that, there were no rate increases this year. The Apex plan stayed flat. and the Sedera plans had no increase at all. I think I mentioned at the beginning, but on the Apex side, there is a rate lock. So the Apex plans cannot increase more than 9% in total across a 4-year period. So if it increased nothing this year and nothing next year, it could only increase 4.5% the third year and 4.5% the fourth year, because they cannot increase more than 9% in total. Apex, like I said, did not have any increases this year. Neither did Sedera. Any other questions?
Yeah, whoever asked that question, I've worked with Sedera and Sela for the last probably 4 years, 3 or 4 years, and I had the exact same question. And I think that the response back that I got was, there's never been a claim that we haven't paid. So, and also if you look at the trajectory of the plan, they're adding more and more members. So their pool of funds that you're sharing in is getting bigger and bigger. So
yeah, and not to get too into the weeds, but the funds they hold are actually funds held for others. So it's not something they could legally disclose, because again, it's not their money, it's your money, it's the community's money. But like Derek said, if you want to, you can certainly do the math and see approximately how much they have on hand. Susan, I see your question there. You certainly can join. I would encourage you to reach out to us, because one thing we can do is get the cost for the inhalers that you do use. So you would know what that inhaler would cost you through WellDyneRx, through the prescription drug program, and also through CleverRx, I imagine, Derek.
Well,
encourage you,
Susan, one thing that you could do is you could go to, send us the prescriptions, discreetly. Don't send them. Don't put them in the chat right now.
Right.
But you could send us your prescriptions, and we can price them out for you through Apex. But also, you can just go on the CleverRx website and type in your prescriptions, and at least it'll give you a cash pay idea. Because if you didn't add the Apex Advantage plan with the prescription, you could just have the basic plan, which is a little bit less money, and just cash pay for your prescriptions. And you would the CleverRx price for your prescriptions would be what you would pay at the pharmacy.
Absolutely. And like I said, Susan, you can send us an email to this, and we will, like Derek said, discreetly get your price as well. But Derek makes a good point there. If you can go with the basic plan, if really all you need is prescription drug coverage, and use CleverRx to get the prescription drug coverage that you need. So you can save money a few different ways. There's a couple different ways to skin the cat, if you will. A question here from Anonymous. Do they cover hearing aids? They do not. Medical devices are not covered. Apologies for that. Any other questions out there? All right. Well, before I throw it back to MBNA, I would encourage you all to, again, please take down our email addresses and phone number. If you have a group of employees and you'd like for us to do a program or a webinar similar like this with you and your staff, please just let us know. We will answer those. We will set that up, rather, and get those answered for you. Oftentimes, it's easier with a small group to kind of ask the questions that you may want to ask. So just send us a note, and we can schedule that and take that, get that on the schedule for you. But if there aren't any other questions, I'm going to throw this back to Rebecca, and we can close up the webinar.
Awesome. Thank you, Kevin and Derek, for joining us today and presenting more information about this program. And thank you to all of our attendees for spending part of your day with us. All attendees will receive an email later today with links to any handouts or any additional information about the program. As a registered guest, you will have access to the replay of this session. An email will be sent when the recording is available or able to be downloaded from our website. And that is all I have for today. So thank you all again, and have a good day.
Thank you, everyone. Bye-bye.